Hi everybody, my name's Sheanna Maine. It's really awesome to be able to speak to you today about biomechanics. I'm an orthopaedic surgeon, which means that I operate primarily on bones and on the musculoskeletal system. I have a specific interest in pediatric orthopaedic surgery, which means that I can specialise in operating on children, and also on sports knee surgery, which is fairly self-explanatory, and something we refer to as limb reconstruction surgery, which involves the process of correcting a deformed or an abnormally shaped bone. And this can occur as the result of injury or infection or abnormal growth, along those lines. And within this discipline, we also do procedures where we lengthen bones and salvage bones that have defects or abnormalities relating to trauma. Now, I love my job. It gives me the opportunity to interact with people and plan and execute surgical procedures. And part of the joy in that is seeing the results of the surgeries we perform and how that affects our patients. Many of these surgeries are quite complex and challenging. And when we are correcting a congenital deformity or growing a limb for a patient or lengthening a bone for a patient with a leg length difference, that can be something that is really rewarding to watch because your patient experiences a significant improvement in their function as a result of what we do. And that's really where biomechanics comes in, because biomechanics is all about the way that anatomy influences function. The appreciation of biomechanics is critical in any orthopaedic discipline because, like I said, we're trying to alter a patient's musculoskeletal structure in order to affect and improve that patient's function. So if you don't understand the biomechanics of the patient that you're starting with, you really can't hope to understand how to improve that. So we need to understand the biomechanical effects of the procedures that we do and the consequences of the surgery we perform. And this decision making can be quite challenging because it's not necessarily all by the book. We know that performing a certain procedure can help a patient, but if it will help the specific patient that you are talking to at the time is a very different question. And you need to identify the other factors that influence the ability of that patient to succeed with the surgery you're proposing. So you need to identify those patients that won't be able to rehabilitate well enough for the procedure to be successful. And this relies on quite a careful assessment of their physical, their emotional, and their social situation. At the moment, we still have a long way to go before we can understand the intricacies of a patient's individual biomechanics and the effect that surgery can have. So there are many different ways that biomechanics can help improve our world. We are not that far away from the creation of virtual biomechanical avatars, which, for instance, you could operate on virtually and use the avatar to assess the results of the surgery before you actually perform it for real. And that's incredibly exciting. We can use biomechanics to create better prosthetics for our patients that undergo amputations. We can use it to prevent and manage injuries in sport, and we can also apply it to other species. I would encourage anybody interested in biomechanics to play a sport. So this might sound a bit crazy, but I started understanding biomechanics probably as a result of my interest in martial arts, and in particular in karate. I was fortunate enough to participate in or to compete in karate at an international level. And I can honestly say that without my understanding of biomechanics, I would not have been the competitor that I was. And probably also without my appreciation of karate, I wouldn't understand biomechanics the way I do. And sport and biomechanics are pretty symbiotic. You need one to understand the other. Playing a sport helps you understand your own body, and that in turn helps you to appreciate movement in other people. The effective generation of things like power and speed and stability is essential for most sports, and that's all dependent upon your individual biomechanics and what you were born with. So I guess to summarise, get out there, play sport, have an interest in biomechanics, and if you're lucky enough to pursue a discipline involving biomechanics, I think it can certainly change your life.